is Michael McBride. I'm a consultant plastic surgeon working at Cosmetech here at Kingsbridge, and today I will be speaking about neck lift surgery. This surgery helps and aims to address a number of key issues with the neck. Most notably, the neck tends to develop a number of issues related on multiple fronts. First of all, the skin can tend to thin, it loses its elastin quality and the levels of collagen as well, so that the skin can become quite fine and wrinkled, particularly in the midline neck. We may accumulate volume, subcutaneous fatty tissue in certain areas of the neck. This can be either an acquired thing or it may be an inherited thing as part of somebody's makeup and what they've inherited from their parents. The muscle, superficial support muscle in the neck, can tend to become weakened and attenuated, forming visible longitudinal lines in the neck as well. Sometimes these may be amenable to injections or non-surgical things, but there may come a stage wherein a discussion about surgery may be appropriate. Moving on then, the volume of the internal structure of the neck, known as the deep plane or the deep area of the neck, we can get a prominence of muscles that form the floor of the mouth and or a salivary gland that can tend to fall below the margin of the jaw, causing fullness and loss of the shadow as it runs along the jawline. So surgery aims to identify which of any of these things are already there and present and what options are available in terms of surgery. And a neck lift can vary in terms of how it accesses, what it treats, whether it's limited to here or it needs an incision on the back surface of the ear extending into the hairline. It all depends on the individual. So the benefits of neck lift surgery are that it aims to address a lot of the either acquired or inherited issues with the shape and contour, and to a lesser degree the function of the neck. If there is an issue with the skin, be it skin excess, a fine quality of skin, it can smooth and or remove skin. This may require an incision on the back of the ear extending into the hairline. If there is an issue with the volume of the neck, be it in the superficial or within the deep layer, the surgeon can either remove that superficial volume, which encompasses fatty tissue, or it can remove some of the deeper volume, which can be a fatty tissue around the muscles of the floor of the mouth. We can either remove some or all of those muscles as well, and or some or all of the salivary gland. Not all of these things is always indicated. Each thing will be unique to that individual's anatomy and what their aims and expectations are. The muscle is also addressed, the superficial muscle, by reapproximating it in the midline with sutures and or suspending it on the lateral neck to try and act almost like a corset. And it shapes and lifts everything that's within the internal structure, otherwise known as the deep structure of the neck. Surgery is carried out under either twilight anaesthetic or sedation or general anaesthetic. It generally requires an overnight stay in hospital. Whenever an individual is safely anaesthetised, then I normally mark incisions using a marker pen, which are shaped around the lower part of the ear, on the posterior surface of the ear, and it also can extend into the hairline. Other incisions may be involved, or one that runs underneath the upper part of the neck. There are different forms of neck lift, and it all depends on the individual's intrinsic anatomy and what their aims and expectations are, whether or not we treat only this area with this incision, or if there is a degree of skin excess, we may need to remove this via the other incision that I've already mentioned. The area is undermined, the superficial muscle is entered underneath the deep plane, and we also may need to remove volume if that is required underneath the neck too. The skin is closed, the sutures are generally they don't need to be removed. I don't use a drain. We use a very light support structure around the head and neck, and then there's a recovery there afterwards. The surgery can take roughly anywhere between 3 to 5 hours, and it depends on the unique indications for that individual. So there's a general recovery after any form of anaesthetic that can take upwards of 4 to 6 weeks. The surgical recovery is generally in 3 phases. There's an immediate phase within the first week to 2 weeks, through which we remove a lot of the dressings, we remove any fine sutures that may need to be removed to expedite the recovery. From week 2 to 3, there's an overall recovery. Swelling and bruising should be almost fully gone, if there was any at all, and hopefully the individual can return to their normal activities, both socially and at work. The longer intermediate recovery then extends upwards of around 6 weeks, through which they can return to maybe any form of exercise. Scars then continue to improve by 3 months and 1 year, at which stage, things will be really, really well settled. The risks and complications of neck surgery are important to relay to any patient. As part of any discussion, a surgeon must sit down and really comprehensively explain all the steps of which risks, side effects and consequences are important. The complications relative to any operation include infection, oozing or bleeding, causing maybe what's known as a small blood clot known as a hematoma, seroma, which is natural fluid that forms in spaces, and or slow wounds or wounds that maybe can open. The risk of all of these is low, and if you institute the right technique, it should be significantly lower as well, because we're removing all the tension off the skin. Specific risks then include residual asymmetry, over or under correction, and or issues with any of the salivary gland if it needs to be removed. But this doesn't always need to be removed in every case. But if it is required, the surgeon can institute a number of key steps to reduce risks even further. Moving forward then, it's about trying to ensure the shape, contour, and that the scars are all appropriate, and that we have a happy patient and a happy surgeon. Other consequences of surgery are numbness of the skin, but an important risk across all neck lift surgery is the risk to the motor nerve, known as the facial nerve that supplies the lower lip. Now, we know that if you work in the deep plane, you visualize these nerves and the risk is low, and across the literature it's less than 1%. If you can visualize structures, as a surgeon, you know there's safety there and you can avoid them. And this risk across my practice is essentially zero. A patient considering neck lift surgery can self-refer. It's important that they undertake an appropriate amount of research, identifying a facility, a surgeon and their team that are appropriately certified, qualified, and that they are comfortable, that they understand their needs, expectations, and fully explain all the steps of what's involved. The average wait time from consultation to surgery can be a variable length of time. It is important that there is a cooling off period, both for the patient and the surgeon, to appropriately really fully understand and process all the information that was discussed and or research further, because there will be other areas that need more detailed understanding. It's about selecting the right time for the patient with knowledge of what the surgery involves, what the downtime, the recovery are, and what the risks, side effects and consequences are. And it's about both the surgeon and the patient making sure that they are absolutely comfortable and confident in one another, because this is surgery that you only want to have done once.